he left a message that basically said on the video, his purpose in life was greater than his circumstances. When I heard that, it really hit me between the eyes to think, I've never looked at my life in that way at all. Gandhi has a life goal or something. I don't. That's not. I just, on this normal path of graduation, job, ... And I remember writing it on my whiteboard in my bedroom, just saying purpose greater than sign circumstances. And I thought, well, that seems like a really sensible way of being able to just frame everything that I do. But what is my purpose?
Welcome to the MindTech podcast, where we dive deep into the unsolved problems in mental health with the founders, investors, and experts building technology to solve them. Startups led by founders who have lived through the very experiences that they later come to solve hold a very special place in all our hearts, and MindData is a bright example of this. Ruane, the co-founder and CEO, overcame suicidal depression after eventually having therapy. Now, Sean dedicates his life to helping others gain insight into their mind and access the support they need by leveraging the power of data analytics. Listen to learn how Sean is building the service that he needed, the advantages of his business model, and MindData's plans to understand a user's mental state without any input needed. One of my favorite things learning about yourself and MindData is the real human story behind it. Could we start there and hear from you what makes this such a human-driven business and mission that you're on?
Yeah, of course, with pleasure. So my journey started back in 2015, and the catalyst was I'm the eldest of three boys. My middle brother, Lee, he unfortunately lost his girlfriend right at the end of 2014 to a stage 4 glioblastoma, which is what ended up being a terminal brain tumor. And from her first kind of headache, asymptomatic from first headache all the way through to passing away, it was very quick. I think it was about 8 or 9 months. So it's very rapid from just normal life. My brother had been dating Holly for 10 years by the time they were 19, 20. So it was an enormous loss for my brother. My mum, that had lost an adopted daughter, seen Holly grow up from a young girl literally to a young woman, and we've never questioned that they were going to spend the rest of their lives together. And actually, at the time, it was the first death that I had ever really dealt with personally. At the time, we still had all of our grandparents, and what a privilege that was to be relatively old and still have all of our grandparents. So I just did the classic man thing and buried my emotions. I thought strong and silent would be the right thing to do to look after my younger brother, be there for my mum. And that worked for a few months, to be honest. But as is true with most things that you push down, they will find their way to the surface and manifest themselves in one way or another. It could be alcoholism, goodness knows. Mine ended up being depression that then quickly turned into suicidal depression come April 2015. So I'll pause there, but that kind of sets the scene as to kind of what led me into experiencing suicidal depression back in 2015.
I really feel for you and your family there. It's something that is just so tragic and so unfair, something that, no one deserves and you couldn't have done anything about. And it just shows the reality of how anyone can be so affected by these harsh events in life, which could send us down very difficult paths with our mental health. And that's why the support needs to be so readily available. So
Yeah.
really feel for you there. Thank you for sharing that. How did you go from that to finding a real sense of mission in mental health? And of course, it's clear that you felt so strongly about the importance of mental health, but how did that become your calling?
Well, I think when I slipped into really bad depression, I was very fortunate to be at university, at the University of Buckingham, and they had an amazing well-being team there to support students going through certain challenges. And I was very, very fortunate to be looked after, if you will, by an amazing therapist called Betty. Betty was a wonderful therapist, originally from Arizona over in the US, and I had then moved over with her English husband and lived in tiny little Buckingham. And for the next 18 months, I had a weekly session with Betty, and she saved my life. She really did. And it was during that time that I happened to be watching a video on a US Marine that was speaking about his mental health challenges. I suspect that, in the evenings, and I was looking for videos and people that I could relate to and understand that maybe there's some light at the end of the tunnel. And I'm very fortunate to find this video. And I think he had, attempted to, end his life in Iraq in 2004. And anyway, he left a message that basically said on the video, his purpose in life was greater than his circumstances. And it was something that helped him frame his experiences. And when I heard that, it really hit me between the eyes to think, I've never looked at my life in that way at all. Gandhi has a life goal or something. I don't. That's not. I just, on this normal path of graduation, job, dot dot dot. And I remember writing it on my whiteboard in my bedroom, just saying purpose greater than sign circumstances. And I thought, well, that seems like a really sensible way of being able to just frame everything that I do. But what is my purpose? And so I just thought, well, I'll just kind of basically throw a dart at a dartboard effectively, and just chose this number of, right, I'll pay Betty's work forward and try to impact 1 million people in my lifetime to improve their mental health. That seems like a relatively unachievable goal, and that's quite good because that means I'll always be striving for it, like the horizon. And so then I thought, well, I'll hang my hat on that. God knows how I'm going to do that, but that's going to be my mission in life. So that's where it came from, and that's really where I decided that's what I'm gonna do in life.
Brilliant. Turning such a negative, dark experience into an opportunity to bring so much light into the world and to other people's lives. It takes a very special human being to do that, and I can really see that's who you are.
Oh,
So
Mr. Thank
it's a
thank
pleasure.
you.
What do you think were the real unsolved problems here? Where has society gone wrong to have
Mhm.
ended up in a situation like that?
Well, I mean, I guess the factual answer would be there's probably an infinite number of data points that lead to people suffering from mental health challenges, and it's extremely subjective. One thing I'll just take a very quick diversion, and I promise I'll bring it back. One thing that I learned from my brother Lee, and we learned this on the journey together, is that a subjective 10 on a pain scale, um, that you can't compare them. What Lee was going through was a 10 out of 10. And we went through this period of him, understandably, as a young man, being angry at the world. He would see smokers, drug takers, and think, well, why aren't they dying? Holly was a healthy young person and was very angry, totally understandably. And he said, well, what that person is going through, a divorce, let's say, well, that's nothing. At least you're still alive. Between the two of us, we started to learn over a number of years. Actually, that's not true. What that person is going through, maybe they've lost their job. That's a 10 out of 10 for them. It's the same as your 10 out of 10 of losing your partner. There's not some objective scale. So the reason why I say that and bring it back is that I think mental health challenges are so subjective. It's so difficult to be able to just produce some objective framework that says if as a society we do X, then actually we won't be experiencing Y. However, with all that being said, from my perspective, there are a couple of aspects. I think number one is, I think the culture in which I was raised as a young man, that these classic things of grow a pair, for example, boys don't cry, man up. These are just sayings that almost become invisible in our day-to-day speech, and yet the subconscious programming of, as a man, you shouldn't be emotional. Any sign of vulnerability or emotionality is a weakness. And weakness is the opposite of being a man. You should be strong, you should protect, you should be there to care for those around you. And I think that was probably the first programming issue, if you will, in my mind, and many others, of course. And the other aspect was that I'm a big believer in the framework of, if you can speak to the right person at the right time about the right thing, you're doing a good thing for supporting. Now, I saw the right person, Betty, we spoke about the right things, but it wasn't at the right time. It was too late. I was kind of dragging myself in there post, suicidal ideation. So it was too late. So I think that whatever we can do to get, that crossover of seeing the right person, right time, talking about the right thing, regardless of the subjective experiences, that's generally going to be a good framework for organizations, universities, therapists, whatever it may be, to follow. So it's a very long answer, but that's kind of my view on that.
So, right person, right time, right care. That is the formula for reacting to deterioration in mental health and changing how we are socially programmed through cultural changes, more, um, you know, more important, nourishing, nurturing conversations in society. Those are what are going to lead to more healthy social programming for future generations that will prevent and proactively address mental health issues. And we'll come on to this topic of proactive and reactive care, as I know Mind Data spends some time thinking about both of those things.
Yeah.
But before we get on to Mind Data,
Mhm.
what were some of the first ideas you came up with to solve this? And why did you land with Mind Data?
Um, so I guess for a bit of context, once I'd graduated from university, I carried this life goal with me since then. But it wasn't the first thing that I really worked on. It was actually on the early team of an HR technology company called Clear Review. Nothing directly really to do with mental health. It's about employee development, which has its roots in employee well-being, of course, but the primary focus on feedback, goal setting, regular one-to-ones. So in the background, I wasn't actually working on anything to do with mental health. But the reason why I say that is over the course of those 5 years, from kind of, three or four of us on the early team, all the way through to being acquired 2 years ago now, I really embedded my love for technology and startups. So that was one foundation. And whatever I was going to do at that point moving forward was always going to be a Venn diagram of technology and the softer human side of my life goal. So that was the first thing that I knew I wanted to use technology, and in fact I probably needed to use technology for scale, if you will. That's really important. I wasn't ever going to do it as a self-employed therapist, as an example. You wouldn't reach a million people. So that was the first thing that I knew. I started to write a book at one point called Recondition. I got to the first page and it said for Betty, because in 2019, heartbreakingly, Betty died of cancer. So I kept in touch with Betty via email, and her emails just stopped one day. And so I think the hardest thing about building Mind Data is knowing that she's not around to see this, which is really sad. And so that planted another seed of whatever I use technology for, it has to amplify the Bettys of this world. I saw that in 2019-20, there was a big shift towards counselor in your pocket type technology, AI driven chatbots, things like that. And by the way, I think they serve an amazing purpose. I'm not here to diminish those. It just wasn't the angle I wanted to go down. I couldn't imagine my journey being absent of a human like Betty. So it was all about technology, and it was what technology can I build to amplify the human to human relationship and support. So that was the thinking and the thought process before I kind of landed on my first technology idea for Mind Data.
Well, may I just say, Mind Data is, I feel, yours and Betty's legacy, and everyone who's been involved in your story, of course. But I hope that she, really does live on through all of the impact that Mind Data has. So
Thank you.
that is
Yeah,
part of her legacy. Um,
thank you.
no, you're very welcome. So of course, amplifying the patient therapist relationship is a worthy goal, and that of course helps therapists do their job better. It helps patients engage better with their therapy, have
Mhm.
greater insights of what's working, what's not. But what do you think you were missing that you didn't get in
Mhm.
your journey?
Yeah. So I think that the first point was to look at therapy and recognize it probably wasn't broken per se.
Mm.
It did its job. It saved my life. But there were elements that did stand out to me that at the time I didn't question until I was looking at how could I improve the therapy experience. The first one was my subjective experience of every time I'd walk into a room with Betty, or therapists since Betty as well. It would always start the same way. Sean, good to see you. How have you been? What's been going on? And with a sober mind, it's a relatively benign question. It's quite easy to articulate a week's worth of experiences and thoughts. But my God, when I was depressed, and certainly when I was suicidally depressed, that was an enormously difficult question to answer. And so I found that experience of trying to download, experiences and thoughts, wrestling with recency bias, it was a really inefficient way of starting. Now I found it therapeutic, getting things off my chest and rambling on for 5 to 10 minutes, but it wasn't therapy. And if I wasn't on the clock with Betty, it wouldn't have ended up being a problem. It wouldn't have stood out to me. The reason why it stood out to me was, you have what they call a therapy hour, which is actually only 50 minutes to allow the therapist time to write notes up, change over, get ready for the next client. So you don't have a full hour. And those 50 minutes, if you're only having them once per week, they go very quickly. And so any minute that you'll feel like you're not in therapy, getting that help is a wasted minute, if you will. So I knew that I wanted to try to improve that, and later learned that that's a standard practice in therapy to patient-led approach. You let them talk about what you want, and whatever comes to top of mind is the most important thing to talk about. However, subjectively, I still don't believe that is true, because very often within 48 hours of having my therapy session, something would randomly pop into my mind. And I'd think, God, I really wanted to speak to Betty about that. So intrinsically, I knew that I wasn't speaking about the right things. I was just speaking about things I could remember, let's be honest. And so with the backdrop of building an employee development system, of a manager talking to their team members, two people turning up being, very much prepared with insights to have a meaningful development conversation, that seemed completely at odds with the way we did therapy. So I wanted to solve that issue of not relying on recency bias from a patient perspective, and two, ensuring that both the patient and the therapist had relevant insights so you could relatively quickly get into a meaningful therapy conversation talking about the right things.
So making better use of your time in therapy and making the most of therapy while you're in the session. And of course that's going to lead to better engagement, better outcomes. The therapist is going to be more more well prepared. I wonder though, what do you think would help someone get to a therapist sooner? Because you mentioned that you had the right care, the right person, but not necessarily at the right time. How is Mind Data going to try and tackle that issue of trying to get people to see therapists sooner when they needed it earlier than obviously waiting for a deterioration?
Yeah, absolutely. So this now comes into what we call in the startup world a pivot. And a pivot is where you start out with a founder's hypothesis, and you say, I think that by building X for Y will achieve Z. And you go out and try to test that, disprove it if you can. And so whilst I was testing with self-employed therapists, we had a host of challenges, with engagement adoption from certain therapists at certain times, because it's just not the way they're trained to do things, understandably. But as you said, it did come onto this idea of, well, how can I be truly proactive with getting people the right support? So this is where we started to deploy our technology into more of an organizational context, whether it's a university or a business, for example. And we enabled our technology to analyze journal entries, to derive themes and mood tracking, things like that, and aggregate all of this insight, obviously truly anonymized, so that the organization can have live mental health data and trends, so that they can then be proactive and provide relevant support to relevant groups of people, or indeed individuals, at the right time. And that may not always be seeing a therapist. Initially, it may well be having a resilience training session with a sales team, as an example, or it may be that your female medical students at a university may need, X workshop or whatever it may be. They need more one-to-one tutor time. who knows, whatever it may be. So that really was our step into, actually, we can get ahead of the curve. We don't have to be entirely reactive with the way that people are supported. Let's give the people in charge the right real-time data on the right people so they can action in near real time to maybe even prevent the need of therapy entirely, even in the best case scenario.
So what you're saying is through organizations, you get access to a pool of people, some of whom may have needed therapy a long time ago, some who may be on their way to needing therapy, some who are in a perfectly fine situation.
Yeah.
And you get everyone to utilize this app and
Mhm.
have certain data points about them tracked so that they can have insight into how their mental state is doing. And from that, they can be given the right intervention at the right time, even if it's a small self help resource. Yeah.
Exactly. Yeah, you're absolutely right. That's exactly the mission and the goal. Absolutely.
Okay, so what kind of data points do you track about each person? Is it the same for everyone?
Yeah. So yes, number one, it is the same for everyone. So it's a universal approach. And if you are to provide aggregated insights to an organization on cohorts, you do need some level of common denominators that are being tracked, so that you can compare and contrast. It makes it much easier. So the one thing that I learned from ClearReview, this previous company, was simplicity always wins out. When you build technology and it does any host of 20 different cool things, that actually sells better because you can do so many things with it. But actually, to embed technology in the long run, just be very simple and intuitive. That's always going to win out in the long run. So we only capture primarily two data points from the end user. It's how you are feeling on that Lee subjective 0 to 10 scale, and if you want to add a few words, notes, thoughts, sentences around why you're feeling that as well. So the action in doing this is, I loved journaling when I was going through therapy. I found it really important to quite cathartic experience. Mini therapy sessions to not just recognize what, how am I feeling, but why. But it also improves self-awareness. It's really helpful for me to look at my journey over the past 9 months and understand my triggers. So they're the two data points that we do, and then we use artificial intelligence to derive multiple insights out of that. And it could be quantitative trend analysis, it could be sentiment analysis. There are so many clever things that you can do with AI based off those two data points. Then with those data points, you aggregate them, and then you can filter by subcategory of student or employee, for example, so that you can get quite targeted insights in real time on targeted groups of individuals.
Hmm. Okay, fantastic. So, with that vast amount of data, I'm sure the insights become that much more meaningful, right? And I think going through organizations is a fantastic way to build that data lake. Is that the business model now then, taking it organization by organization, as well as the kind of therapist by therapist route? And yeah, could you just elaborate a little bit more on the business model there?
Yeah, with pleasure. So the business model was always going to be a recurring SaaS-based model. Now, initially, it was going to be based on monthly recurring revenue with monthly subscriptions, um, and now this is going to be more focused on same principle but annual recurring revenue. When you're an organization, typically it's better to sign up for say 1 year at a time rather than month by month. Let's just say. So the financial model is that a software license that you use SaaS-based. And the primary focus now is an organizational setting. That organization may look at a private company, it may be a university. We're working with more universities now. It could be a sports team to enable them to have real-time data to compare and contrast against physical performance data, as an example. So whilst our technology still does support self-employed therapists, we, at least for now, have taken the foot off driving that at the moment. I think that we were slightly too early in the market. We were getting great adoption, but we had to get what we'd call like innovators. And I don't mean that in any kind of disparaging way to people that weren't adopting it. It's a genuine term that when you look at this adoption curve of markets, You get the innovators, and then the early adopters, and then early majority. And it just transpired that the work we would need to do with the average self-employed therapist was quite a big change management journey that we'd take them on. And when we did that work, to look at £25 per month subscription to get the economy of scale, it's just too difficult for a growing company to do. So yes, we still do support them, but we're not actively targeting them. What this has enabled us to do is build, AI dashboards that I've been talking about. We've never needed that with self-employed therapists, but this opens the door for clearer messaging, understanding, and aligning with organizational goals that maybe self-employed therapists probably wouldn't have per se. And so it feels a lot more aligned to the needs and requirements of these organizations, where ultimately, regardless of what you're doing, data is king, whether it's your financial data, your employee engagement data, performance data, and now real-time mental health data. I think it's really important.
Wonderful. So you are tracking all this about all the people in each organization. With the interventions, what are you thinking? Are you thinking self-help resources, access to therapists? What other interventions are you thinking of?
Well, that's a very good question. So at the moment, MindData is an intervention provider, if you will. We were born out of what can we do to facilitate existing frameworks and models? How do we amplify the existing support that you have as a university, whether that's a wellbeing team in situ, whether it's passive resources? What can we do to make sure that those support mechanisms are being maximized for the most effectiveness? And I still think that's our primary mission, actually. I still think that's the case. Now, if we look further down the line, it may well be that if we continue to grow, that we start to bring some of those in-house. It could absolutely work out that way, where we produce our own library of resources. Maybe we have our own in-house team of therapists. Who knows, that may be where it ends. But I truly believe that right now, the pandemic did an amazing job of drawing attention to this. I think that a lot of organizations and universities over the last few years have done some superb things to improve those support networks. But I do think that actually the real-time measurement of effectiveness, where to put the investment, what's working for which group as well, this equitable approach, I still think needs improving. I would love to see organizations move away from a one-size-fits-all spray and pray approach to more targeted, focused interventions for different groups of people. What works for one group probably won't work for another. So that's where I see our primary goal going, focus over the next 2 years, let's say.
Great. Yeah, starting by building that infrastructure, connecting existing services, and
Mm-hmm.
once that infrastructure is moving things along, connecting people in the right ways, then you have the infrastructure in place to be able to add your own and do so with a massive population sample to test things and build the evidence for your interventions working. So
Mm-hmm.
I
Yeah,
can see the
absolutely.
roadmap. Yeah. So this sounds like a very neat solution. Really shining a light on these dark areas of the mind that we don't understand with data, and of course connecting these kind of interventions with the people who need them at the right time, in the right place, with the right person. But what else do you think is missing in mental health? Do you think
Mhm.
this is a comprehensive solution? And if so, then how is it addressing every part of it? If not, what
Mhm.
else is missing here?
So I don't think it's a comprehensive solution. Actually, I think any kind of technology or support that's in the mental health space or world ultimately should recognize it's just one piece of a very large jigsaw puzzle. And it's a spectrum. It's very grey. I mean, it's easy that when we're talking about investment or categorizing ourselves on LinkedIn, that we are a mental health company, and we see that this company sits within a mental health space or it doesn't. Actually, the truth be told is that most things in our lives have some minor or major impact on our mental health. So where do we draw the line on the learning and development platform provided by employees? Where education plays a role, career progression, financial well-being, the relationship between a manager and a team member, physical fitness, for example. As you can imagine, that if you took a negative lens on any of these, they would very likely have a negative impact on mental health. And yet they wouldn't be classified in any way as mental health technology or mental health services. So everything is a spectrum, and recognizing that you fit into that is really important. But the aspect I would say is that I think self-awareness, anything you can do to improve self-awareness, is absolutely key. Emotional intelligence, I think, is the future. I think that that's going to be one of the hardest things for artificial general intelligence to be able to replicate. Number one, that the creativity and the emotional intelligence that underpins relationships and human experiences will probably be one of the last things, if ever, that AI can take away from us as humans, if you will. So improving emotional intelligence, self-awareness, absolutely crucial, because ultimately we are our own canary down the mines, if you will. You can't really get much more proactive than recognizing your own mental state, if you will. That's always going to win out on anything. So that's, I think, number one. Number two is creating a world where far more people are trained and qualified in different facets of support. I'm a big proponent of moving towards predictive and proactive model to mental health, but you always need an incredibly supportive model of reactive mental health support. And so I think that making sure that we have a well-funded, well-established reactive support network, whether every university doubles its number of well-being professionals, whether it's training lecturers, for example, in some degree of well-being, whether it's a corporate mandate that every company has at least one mental health therapist on site as part of the HR team as standard practice, for example. I think that's really important as well. Now, there are two things. I mean, the emotional intelligence side of it, Mind Data definitely touches on, but certainly, bolstering the amount of resource that is in the support network. Mind Data doesn't directly address that. We can highlight and we can say we think you'd need X in Y. We can measure the effectiveness of when you employed that person, but we don't provide that. So I think that there are two elements that need addressing much closer to the mental health side of this spectrum.
So educating people on how to gain greater insight into their mind and
Mm-hmm.
making the appropriate resources that much more in reach wherever they are, whether it's a workplace
Mm-hmm.
or school, or if
Yeah,
they are on their phone all the time, for
yeah,
example.
yeah,
Okay,
yeah.
that makes complete sense. Those sound like very fundamental things. And I guess for anyone listening, it opens up some possible avenues for innovation, which is very
Mm.
exciting.
Yeah, absolutely.
Now, of course, the name is Mind Data. And as you
Mhm.
mentioned, data is king. How valuable do you think all this data is that you're collecting? And how are you making this data as valuable as possible?
Yeah, I mean, data in and of itself is generally not that. There's a difference between data and information, right? And information is data in context. So I think that the data can be very valuable if analyzed in the right way, presented in the right way, and crucially used in the right way. There's no point having all this data if it's not leveraged and put back into this kind of flywheel approach, and use this data to address some of the triggers and drivers of lower mental health. So I think that data in context is going to increasingly become more and more valuable. I think one of the things that we'll see over the next 5 years is, quite understandably, a lot of organizations have put in resources support after the pandemic. Awesome. However, if we're going to continue that for the next 5 to 10 years, at some point, the CFO, senior leadership, even employees, they're going to want to say, well, is this working? Maybe we've got a reduced budget, for example. So where do we put this investment? Who should we be targeting? At what point? We can't keep spending hundreds of thousands on a broad brush approach and not really seeing the dial moved. So I think that over the next 5 years, we will become more intelligent in the way that we invest and create mental health support mechanisms. It has to be. So I think that that's a good example. I hope it's a good example of how data will underpin the future of mental health. But I think to bring it back to your original question, insights are always going to be more important than data. You can't have insights without data. It's a somewhat of a necessary evil, but it's going to be about insights. Maybe one day we'll rename to Mind Insights or something. But I think that that's going to be really important. Getting the right people around the table using these meaningful insights to move the dial for targeted individuals.
So data that enables one to change something, take action in their life, whether that be for the user, the
Yeah.
therapist, the organization, its value is determined by the action that it can help um,
Yeah,
stimulate, which is
absolutely.
a good way to frame it. Now, lastly, because the time has flown by, um, what are you working on right now that
Mhm.
excites you the most?
Well, actually, the thing that we're working on at the moment is looking at more creative ways of how we can improve the types of insights we have. How do we expand that data lake? And how do we very cleverly derive meaningful insights from there? And my exciting thing that I really want to tackle over the next 2 years is passive collection. I think that would be a really exciting point. Obviously, we're a growing company and we have to actively engage people to collect certain data. But the future of being able to cross-reference social media usage as an example passively, like just don't do anything different. Let us just kind of take data points that are relevant. Obviously, the number one thing here is ethical collection of data. It's the number one thing that we do at Mind Data. A legal bar tends to be lower than an ethical bar typically in how you collect and use data. Always set an ethical bar for yourself, not a legal. So that's really important. But I think that excitingly, creating paths of passive collection from non-directly related mental health data points would be really important to be able to build a holistic digital mask of someone and leverage that. One analogy that I'm actually working on at the moment to create maybe some Instagram ads are, look, at the end of the day, Spotify probably has more tailored, personalized data on me to be able to reflect on what I listen to, who I listen to, for how many minutes during the year. That type of insight, that granularity, dare I say, is probably more detailed than what the average university or organization has on than their employees' mental health, for example. And that's a travesty. That should not be the case. So taking the mechanisms that Google or Spotify use, the granularity of that data to be able to target ads, we should be using that same technology to have that laser targeted approach to support individuals and provide organizations with a Spotify wrapped approach to individuals. Why shouldn't we be having that level of detail? Again, ethically, the individual has to have autonomy. That's crucial. You can't sneakily take this and say, surprise, here's your mental health wrapped that your manager's using to fire you, for example. Has to be ethical collection, privacy by design, autonomy to the individual. But that passive collection to have hyper targeted insights, man, that's something I'm really excited about over the next couple of years that I think Mind Data can play a big part in.
Wow, totally agree. Is that something you're working on right now? This passive collection of
Yeah,
data?
yeah. Well, ideation stage.
Hmm.
We're certainly at that stage of ideating. We're about to open up another round of investment, and I think that we'll look at some R&D to really understand integrations, passive collection through APIs. I think it's really important to build up that holistic view. That's very exciting.
Very exciting indeed. Sean, it has been a pleasure to learn about all the work that you and your team are doing at Mind Data to help people better understand themselves and access the support they need at the right time with the right person. So, for everyone listening, how can people support and follow Mind Data?
That's very kind. So minddata.io, minddata.io. And actually, I share a lot of updates and insights on my founder's journey as well from my LinkedIn page. So, hopefully you'll see my name on this podcast episode, but Sean Ruane, find me on LinkedIn. It's quite a rare name, so hopefully I'll come up fairly towards the top of your list. But also connect with me there. Happy to talk about all things mental health and technology and the founder's life. So they're the two main aspects, I would say.
Perfect. Well, Sean, I will be connected with you on all of those aspects
Yeah,
into the future, and I very much encourage everyone else to do so as well. Thank you very
thank you.
much.
Thank you for the invite. This was a pleasure.
Every startup that has featured on MindTech is solving a mental health problem with a technology-enabled solution. To get a full picture of all the problems these startups are working on and all the solutions they're offering, sign up to the email list in the description to access the MindTech Matrix. This is the first visual representation of how mental health problems are being matched by innovative solutions. You'll also be updated whenever there's a new episode and get early access to test some of the products that are discussed in the podcast. Everything you need is in the description.